Moving to Kenya now, Kenyan Health Ministry says that it has detected the B1617 COVID-19 variant. The variant was detected in 5 Indians who arrived in the East African nation on Thursday last week, just before Kenya banned flights to and from India. This comes days after the same variant was detected in neighbouring Uganda. Let's get more then. We're joined via Skype by our correspondent in Kenya, Sarah Kimani. Sarah, always a pleasure to see you. A very good afternoon to you. What can you tell us? I mean, we're also in South Africa here in panic mode at this time as we're hearing about the possible entry of people who may have been affected by the strain that was detected in India, and in Kenya it is in fact then a reality. Is there panic on the ground? And talk to us about what's happening, what happened, and of course now those gates to Kenya have now been closed.
Well, indeed, it's a good afternoon from Nairobi floor, and good to always speak to the SABC viewers. Now, what has happened is that these people, 5 Indian nationals, got to the country through the Jomo Kenyatta International Airport, and they were heading to Kisumu, and indeed they got into Kisumu, but that is a city just outside of Nairobi, and according to the health ministry, when tests were done, 18 people in the flights that were coming in from India were actually found to be COVID-19 positive. But these particular 5 people were found to be carrying the variant that was first discovered in India. And so they have been isolated. Of course, there is panic in that part of the country because the news has just broken. We understand that they were here to work in a factory in that part of the country. The tests have been taken also to the research institute here just to be able to now separate the genomes and be able to get more information from that. The health ministry is saying it will be providing more information. It says even though flights after that were suspended between India and Kenya, it was only a matter of time because there's a lot of business, there's a lot between Kenya and India, but also a lot of Kenyans go to India for treatment. So, and the fact that the countries are interconnected, it was only a matter of time before the variant was found in the country.
And I mean, how prepared is the country should this particular variant of COVID spread in the country? I mean, throughout Africa, there've been a great concern about whether the health facilities can handle that sort of pressure. I mean, I'm sure you've seen, Sarah, some of the really scary images and visuals that we've seen coming out of India, and one fears if that could hit any part of Africa.
Yes, indeed, and that's the reason why Kenyans are worried, and probably the reason why the Kenyan government decided to begin tests at the airport to be able to control the entry of the disease full throttle into the community. But there is a scare that maybe the country is not very well prepared. Take, for example, the current strains that are in the country. The government is struggling to control. There's not enough oxygen. There are no ICU beds. In fact, in most cases, we have seen relatives of COVID-19 patients coming out on Twitter, on WhatsApp groups, looking for beds in ICU facilities in hospitals for their relatives. So it is, of course, worrying that the strain is finally here, because a lot of people feel the Kenyan government has not been very well prepared to handle this disease.
All right, Sarah, thank you very much. We'll certainly be relying on you for that update coming from Kenya. Much appreciated, Sarah.
Thank you for having me.
All right, Sarah Kimani, our correspondent then in Kenya, as of course the Kenyan Health Ministry has said that it has indeed detected the B1617 COVID-19 variant. That variant was detected in 5 Indians who arrived in the East African nation on Thursday last week. So we'll certainly keep up with Sarah just to find out and get more information for you. On that note then, the Health Ministry